And now a little bit about our speaker. Ms. Book has worked in the field of social work for over 25 years in a variety of community and hospital settings with an interest in geriatric population. She has worked with individuals, families, and as a leader of support groups. She is the center coordinator and clinical social worker of the NPF Center of Excellence, the Parkinson Pacifics Research Center at the University of British Columbia. She has become a leader in the PD community, serving as a speaker at support groups, a presenter at neurology meetings, a faculty member of the Allied Team Training Program, and a mentor with the National Parkinson Foundation. She has also coordinated a blog design for neurological social workers and has an interest in raising awareness and developing resources for people with Parkinson and the children and teens. She has earned her Bachelor of Social Work from the University of Manitoba and her Master's of Social Work from the University of British Columbia, with her thesis focusing on caregiver stress. And she has continued to expand her training throughout her career. And now I will pass it on over to Ms. Book for her presentation. Thank you.
Thank you, Kelly. I am unable to see all of you and a little tricky to see the chat. So if anything comes in, Kelly said that she will let me know, but I'll try and keep an eye on everything. First of all, can everybody hear me okay? So maybe, Kelly, you can tell me whether or not my voice is loud enough and everybody can hear.
Yes, I could hear you. If any one of you cannot hear Elaine, you can message the chat box and I will see if I could address the problem.
Okay, perfect. Yeah, thank you so much for inviting me to speak tonight. As Kelly said, I'm Elaine Book and I'm a social worker at the Movement Disorders Clinic, and have had the great pleasure of being in the clinic for over 16 years and really having had the opportunity to work with a variety of people in a variety of different stages and ages of their condition, but certainly having the opportunity to work with people and their families as they navigate kind of this Parkinson's journey. So the plan for my talk, I'm going to talk a little bit about the common emotions that children experience and how best to support kids, some ideas on parenting with Parkinson's, and ways to maintain family wellness. And certainly I'm going to provide some resources at the end, both for parents and for children. And so really to make my talk as relevant and meaningful to you as possible, rather than me telling you my thoughts on parenting with Parkinson's, really this talk and the slides are really based on comments that I have heard from real kids and real live parents who are living life with Parkinson's disease. So certainly feel free to type in the chat, maybe the age of the kids that you have in your world, and that just gives me a sense as well as who's in the room. Great. I think the other thing that I will say too is because we have decided to record this talk, there are different points where I'm going to be posing kind of questions that are, if we were chatting, people might unmute and add in, but they are also kind of reflective questions. So nobody needs to feel that they have to respond in the chat. These are also just kind of questions for you to think about as around this topic. So I'll pose out some questions, but like I said, just feel comfortable listening and no pressure to join in and respond. If you want to, by all means do, but it's totally up to you. Okay, on with the show.
Sorry, may I?
Yeah.
So we have a comment from Susan Uber. She says she has granddaughters that are ages 2 and 4.
Okay. So Kelly, just in the interest of confidentiality, you don't need to say the person's name since this is being recorded and is going to live on the website.
Yes.
Okay. So, so Parkinson's disease, it is a family affair. Um, and it's said that because it really does change life for everyone, both in your immediate family and in your extended family. And this, of course, includes your children. And as a person with Parkinson's or a care partner of someone with PD, you might wonder, well, how does Parkinson's impact my children? So, research into the impact of Parkinson's disease on children is still very new-ish, and is certainly limited in volume. Now, despite the limited research on specific needs and coping strategies or concerns of children with people with Parkinson's, we can still draw on like the lived experiences of many family members and people who are living with Parkinson's, but also from research of the impact of other parental chronic conditions on children. So we can look at the research of the impact on children in the MS community or in the dementia community. So, those areas have had much more robust research done on the impact on children. And so we can look to the research in those areas as well. But what we do know is that children, regardless of their age, tend to want more information rather than less. They tend to want more information early on about Parkinson's disease, and they want to know what to expect as the disease progresses. And also, we know that when children have a clear understanding of the condition, that can really lead to less fear, less anxiety, and less distress. And with more attention being given to families, we are starting to learn more about children's unique needs and how those needs may change as the Parkinson's progresses. So, just as symptoms vary and change over time for each person with Parkinson's, there's a lot of variability in the reactions, in the emotions, in the needs of each individual child within the family. So, how does PD affect children? Some of the common feelings that some children might experience might include shame or self consciousness about the unusual presentation of Parkinson's, especially with respect to reactions from friends or even from strangers. And there may even be anxiety about the stress in the parents' marital relationship that might be caused by PD. Children might sense a tension between parents due to the diagnosis or as a result of the symptoms of Parkinson's. There may be sadness, fear, anger, grief, all common emotions really regarding the changes and the losses of experiences with the parent with PD, or about the anticipation of future losses or future lost experiences. There could be loneliness as the healthy parent is spending more time or is more focused on the person with Parkinson's. There can be worry about the risk of developing PD themselves. Is this contagious? Is this genetic? Worry. There may be worry that parents feel guilty about the impact of the PD on the family. They may even have some financial worries if the family income has changed as a result of working less or a disability pension. There might be worry about the impact on the parents' health, on and their own future aspirations and decisions. And so they could even be feeling overwhelmed about caregiving responsibilities. And there may be frustrations with their activities being restricted. They may find it harder to socialize as they might not want to bring friends home, or perhaps they feel badly about going out and leaving the family at home. So, as I talk about things, perhaps you have noticed some of these emotions or feelings in your children or grandchildren, depending on your relationship, of course, or maybe there are other emotions that you have um, noticed over time. So really just kind of thinking about what is it that you're seeing in your kids? How have you and your children managed these emotions? And again, you're welcome to jump into the chat, but no pressure to do so. Now, a diagnosis of Parkinson's disease will certainly present challenges for your family, ones that you never ever expected nor ever wanted. It is, however, to recognize that the potential for positive effects in children, that there is this potential for positive effects, the hidden benefits as a result of the challenges and the adversity. So, living life with a challenging parental illness can certainly strengthen family relationships, can lead to improved coping skills for children, and provide a sense of pride, confidence, and maturity with a well developed sense of empathy and compassion. The children may be more accountable to their family and their home responsibilities, and really might even foster more independence than children in families without a health condition. Being helpful can give them a sense of value in the family, a sense of comfort, a sense of security. And with good support, the challenges that are created by having a parent with a health issue might lead to new opportunities for children to grow in unanticipated ways. Having Parkinson's disease in the family can actually promote healthy personal growth. So I'm wondering again, kind of a reflection time. Have any of you noticed any of these positive side effects for your children? And if you haven't noticed any so far, maybe take some time to think about that. I suspect that there is something likely there. Oftentimes we have to look for it, but attending to the positives in a challenging situation is often considered a coping strategy. So, supporting your children will require some thought and preparation, awareness of age and stage and their personality, as well as a bit of a coming to terms on some level of your own limitations. So, you coming to terms with kind of your condition, with your diagnosis, and that will help as you support your children. So, sharing the diagnosis is certainly a starting place in supporting your children. And for those of you who have maybe not shared the diagnosis yet, you might be nervous about that, about when and how to tell your children. Oftentimes, parents think that Parkinson's disease is not affecting their children and often worry that giving them too much information might frighten them. However, breaking the silence can really actually decrease anxiety in children. The anxiety that they may be seeing things that aren't that hasn't been spoken about. Children tend to be very perceptive, sensitive, and intuitive, despite sometimes being a little bit self absorbed. And oftentimes they know if something is not quite right. So, without information about what's actually going on, they could imagine things that are far worse than the true diagnosis of Parkinson's disease. And also, if your children hear about the diagnosis from someone else or overhear conversations that you might be having with others, that trust might be damaged between you and your child. And it actually may even send the message that you don't believe that they can handle this information. So, secrecy tends to be more harmful than sharing the truth about health issues in general. And children certainly may be more afraid of the unknown and actually tend to do better with, again, age appropriate information about what's going on. So, whatever the age of your children, do consider sharing the diagnosis, and you might want to share about the process of how it was diagnosed. Certainly, providing information about the disease and taking into consideration the age and developmental stage of your children. Communicating your best understanding of what might happen. And you might even consider practicing what you are going to say with a close friend or family member before talking to your children so that you can really get comfortable with the language and actually get comfortable with what it is that you really want to and need to say. So, again, really just kind of reflecting on where you're at in this process. If you want to share whether or not you have shared the diagnosis or you have not yet shared, how did you do it? What worked? What didn't work? And for those of you who are thinking about it, again, kind of giving some consideration to who your kids are and what is going to be the best way for them to receive this information. For some people, it might be in the car when you're driving and you're not looking at each other. For other kids, it's going to be across the table with pizza in front of you. Just really think about who your audience is and then go from there. So, in order to support your children, you need to check in with yourself. Your attitude about Parkinson's disease is really important, as children often model after their parents and they learn a lot about coping from their parents. So, you want to promote an honest and authentic and a hopeful attitude whenever possible, presenting doctor's appointments and hospital visits as valuable resources and also as a source of positive support. And really, you can even highlight all the research that's being done and the many, many specialists out there who are working hard to improve life for people with Parkinson's. You also want to connect with other connect them with other adults in their lives. So that might be teachers or coaches or neighbors, or maybe it's extended family who might be able to offer support as needed and who can also kind of keep an eye out for any changes in your children that might be related to the Parkinson's in the family. And really consider helping those adults to understand Parkinson's and to convey the same messages that you're delivering with accurate information and also with the same philosophy and attitude that you want to have reinforced with your children. So, communication is key. Communicate honestly, openly, frequently about Parkinson's. Communicate about how PD affects the family and discuss issues and discuss worries. I have a saying that every worry needs a plan, and I'm going to talk a little bit more about that later as well. But it's just so important to have those things out in the open. You want to work on finding solutions to problems together. And of course, always focus on what is working well. When we look at what's not working, let's look at what's also working. It's helpful to let children know what tasks or what times of days might be challenging for the person with Parkinson's and what they can do at that time. So if the person with Parkinson's is having an off time or is unable to, is waiting for the medications to kick in, you might give the children in the family some ideas of what are helpful things that they can do at that time. We want to replace any fear with knowledge. We want to acknowledge feelings that they might be having and also provide reassurances that the children need. They may have questions like, what happens if you go into the hospital? Or will we have enough money if you stop working? Can you still drive me to soccer practice? Whatever their questions might be, meet them where they're at, answer them in a simple way, and provide the reassurances that they need. And again, you kind of really want to provide that or promote an environment where they are comfortable to ask questions that they have and respect that they may or may not want to talk about it, and that's okay. Is if they may want to talk to somebody else about it, or they may bring up something to you that you're not sure how you want to answer it, and you can say, you know what, I'm going to think about it, and I'm going to come back to you with that, and just make sure that you always do go back to them. So here are some ideas that might be helpful as you parent with Parkinson's. Try to preserve that parental role of the person with Parkinson's. So it's really vital um, that for children to continue to see their PD parent as a parent with all the same expectations and approaches to parenting, including enforcing boundaries and discipline as they always have. In two-parent families, the well parent should try not to shield the PD parent from the usual involvement with the children. That stability and consistency will create a sense of security and normalcy in the home. Now, with time and with progression of the condition, the ability to perform all the daily parenting responsibilities might vary due to motor and non-motor symptoms. There might be changes in the routine, there may be delays in day-to-day life, and those changes within what that parental role can look like. And that's okay, that's going to happen, but really trying to preserve as many aspects of the parental role as possible. Recognize that it's also not all about the PD. As you raise your children, there will be challenging times and behaviors that are more likely related to their social and emotional developmental stage and are completely unrelated to Parkinson's disease in the family. So not everything is a result of the Parkinson's, but you do know your child best and how they handle change, what their coping style is, their communication style. And so really look to find strategies that are going to fit with who they are. And certainly get help as you need. You do not have to be alone in this. And you also do not have to be the only source of support for your children. So if you notice your children struggling with family, with school, with friends, and those struggles are maybe lasting a little bit longer, or perhaps are getting worse, seek professional help, either from a counselor, or you might start with your family doctor. A close relative or a friend who shares your philosophies on coping and parenting might also be a good option too. But again, look to access the right fit for your child. And remember, there is no such thing as the perfect parent. Your children can live with your imperfect attempts. Mine do all the time. And you can certainly forgive yourself for not being perfect. It truly is a work in progress, this whole parenting thing. Try to minimize the thoughts of I should. Let those expectations fall by the wayside. We can be so hard on ourselves. I should be stronger. I should be calmer. I should be happier. I should be this. I should be that. And oftentimes that inner voice is often much harsher than the voice we would ever use with anybody else. Sharing your emotions with your kids can be tricky. People often tell me that they hold their emotions in an effort to remain positive for their children, and really question if they should allow their children to hear and see how they're actually feeling. And so my answer my answer to you on that is what the kids tell me, that they need a balance. It's fine to break down once in a while and expose your frustration and your grief. That's being authentic, that's being honest. But it's also important to try to manage the frequency that happens and what that breakdown looks like as best as you can at the time. It certainly can be upsetting to children who look to you for stability and guidance. But at the same time, it's also important for them to see and remember What you do is far more powerful than what you say. So it's important for them to see that it's acceptable to express your emotions along the way, and how you then deal with those emotions and how you move on gives them permission and skills to do the same thing. So, as you kind of think about this, think about perhaps how you have navigated some of your own emotions with your children, or how you might start to do that as you need to. And certainly, if anybody has any tips that they would want to share with the group, those in as well. So, in thinking about family wellness, oops, sorry about that. There we go. Take care of yourself. And this applies to your care partner as well, even though you may not be requiring a whole lot of care at this time, referring to kind of the partner in your life. We refer to them as your care partner. Living life with Parkinson's disease is not a sprint. It is really a long distance marathon, and it's so important to pace yourself. What may be most helpful to your children and to your family as a whole, more than anything, is to take care of yourself and the care partner as well, so that you can remain balanced and patient and an active participant in life. Children are highly sensitive to your mood, and almost universally, they will say that seeing you struggle emotionally can be one of the toughest parts of the whole process. Now, stress, we know, can negatively affect our health and certainly deeply influences the well being of the children. Now, we can't avoid all stress in life, but minimizing opportunities for it where you can, and of course, using stress management strategies, can have a significant positive ripple effect in the family. By taking time to exercise, to see friends, by asking for help, maybe to even accomplish those things, to ask for help so that you have time to exercise or have time to go and see friends. This is all really setting a very good example, an essential example for your children. You are showing them, and again, much more effectively than telling them, you are showing them that it is okay to pursue activities that you enjoy, and it is okay to take care of yourself. And everyone will benefit. It's that idea of putting the oxygen mask on yourself first so that you can then help others. So, modeling healthy behavior, living in the present, creating balance, accepting help. These are all, and when I say accept help, that might be with carpooling, that might be with meal sharing, that might be with childcare, or perhaps it's using a grocery delivery service. All of those things are going to contribute to family wellness. And sometimes that word help is a hard one for some of us. And so maybe even reframing the word help to changing your verbiage to what I would find useful. Sometimes that's a little bit easier for us to take. So the next one is here: consider revising expectations of family life with more manageable activities. So some long-standing rituals or traditions might need tweaking. So perhaps, you have a ritual of going for a picnic every Sunday with the whole family, and historically you make all of the food. Well, you still can go for that picnic, but maybe you're going to pick up a pizza along the way. Or, you normally host the family holiday dinners and do all of the cooking. Maybe you still host, but it changes to a potluck. Instead of baking the birthday cake, you buy the birthday cake. So it's just really revising expectations of yourself and in the family, and finding kind of a new reality and living there. And sometimes there can be some surprising silver linings to doing things a little bit differently. We don't have to do them the same way all the time. focus on what you can do together. And so, as you try to live in the present and create balance in your life, focus also on your blessings. Recognize that you may not get everything right as you navigate this parenting road with Parkinson's, and be kind to yourself about it because you might not have gotten it right without Parkinson's disease in your life. No one welcomes some of the unpleasant changes that Parkinson's disease brings. But in the end, children will just want to feel secure in knowing that you will be able to manage whatever comes your way, that you will be able to get the help that you need. And despite the Parkinson's disease in your family, you will all be okay. You may be different than what you expected, but you'll be okay. And when you look at how you are living life, ask the question, is this sustainable? And if it's not, then something needs to be adapted, something needs to be shifted. So if how you're managing right now is sustainable, great. If it doesn't feel sustainable, then there may be some tweaks that are required. And despite best efforts, you may still worry. Worry about the kids, worry about your health, worry about finances, worry about future on many levels. And as I said earlier, every worry needs a plan. So if you can look at the worry and then come up with a plan to address it, including how or when, sometimes that can help the worry from becoming all-consuming. Here are a few books that people have found helpful. And I think, Kelly, will you be able to send everybody who's attended kind of this list, or I guess this will actually be posted on the website as well. So just some other resources and books as well. And then I just kind of thought at this point, I would just open it up to questions, but also kind of back to you.